Good morning, students. We now go to the topic of home visiting. As you all know, in your second year, you have already visited the families. It's one of the essential parts of community health services because most of the people are found in the home. Home visit fulfills the needs of individual, family, and community. Home visit is considered as the backbone of the community health service. A home visit is a family nurse contact which allows the health worker to assess the home family situation in order to provide the necessary nursing care and health as related activities. So the definition home visit is defined as a process of providing the nursing care to patients at their doorsteps. It requires technical skills, resourcefulness, judgment, and relationships. It is defined as providing the services to family at their doorstep to maintain the health and reduce the mortality and morbidity in family. So, in your second year, you have already learned about the principles of home visiting. So, you can read out the principles of home visiting. So, when carrying out the home visit, the community health nurse should follow certain basic principles. The home visit should be have a purpose and objectives. Simply we don't go to visit the home. We should have a purpose and its objectives should be planned according to priority. It should be clear, regular, and flexible according to the needs of the family. First of all, introduce yourself, your institution, your purpose of home visit, and collects facts about the individual family environment. You have to establish good interpersonal relationship, carefully listen to family and understand the other person's point of view. Health education, nursing care should be scientific, should use safe technical skills and scientific nursing procedures, involve the whole family as much as possible during nursing care. The nurse and family members must develop a positive interpersonal relationship in their work to achieve the present goals. Evaluate your own work periodically. Make a note of important facts about the home visit in your diary. And thanks to the family members and individual for the good response. Then the purpose is to find out the needs of the individual family and community, to provide domiciliary midwifery as well as care for the pregnant, delivery and puerperal mother and infant, to give care to the sick, to a postpartum mother and a newborn with a view, teach a responsible family member to give subsequent care, to assess the living condition of the patient and the family and their health practices, to provide basic services for minor ailments, to provide counseling in family planning, immunization and nutrition, to give health teaching regarding the prevention and control of diseases, to establish a close relationship between the nurse and the public for promotion of health, to make use of an referral system and to promote the utilization of community health nursing services. The steps of home visit is to first is fact finding, data finding, planning action with the individual and family, action and health education, follow through, evaluation of services, explain the use of home visiting bag. So fact finding means facts finding are the first step during home visiting. It helps to study the clinical and other records to get a understanding of what has to be done with which is given below. Then, so fact finding, you have to prepare a map of the area, location, house, road, temples, etc. Prepare family folders, collect information on the family members, that is family member, occupation, education, date of birth, religion, income, past history, present illness, use of family planning, immunization, etc. Use of technical skills and nursing procedures, establish an interpersonal relationship. Be polite and courageous. Show the interest towards the family. Identify the needs of the individual family members. Discuss the problem with the family members and find out the possible solutions to the problems. Then you have the data finding, planning actions with family, action and health education and follow through. So data finding, after completing the fact finding, the process of analysis begins. The data of the members should be honest, based on facts and not an opinion. The personal, emotional, spiritual aspect should be involved, are taken together. constitute the usual health problems. The problems and the facts should be show exact problems and what is he expect to do. Discuss the points step by step and examine the matter critically. Then only one comes to the conclusions. Do not jump and do not make any hasty conservation. After that, the nurse helps the family to plan and use local and outside resources. Next one is planning actions with the family. It is the most important in all our work and relationships. Make good and realistic objectives and plan how we are going to achieve these objectives. First priority should be given to the essential and basic needs such as hunger, then only the personal hygiene, safe water or sanitation. That is why planning is very important and should be based on the condition of the family, home environment and local resources available in the family. In order to be practical, planning should be also based upon short term or long term objectives of the family. Some alternatives to plan or suggestions are also helpful. Do respect the individual's ideas, suggestions and solutions. Good planning always leads to in doing good action and achieve objectives. Action and health education. After planning for a formal home visit should be done to solve the problems. On the first visit, community nurse should introduce herself and explain the purpose of a visit. The talk should be informal, giving plenty of opportunities to ask a question and provide a platform for the discussion. The action and the health education should be as per the family time schedule. Find out what is the best time for teaching them. For example, if they are drying food in the yard, you should teach about food storage and help them for proper drying. This help to provide effective teaching as you are helping them. It also builds a good interpersonal relationship. Emphasis should be given on practical more than the theoretical. Then you have the follow. It is one of the most important steps of the home visit. Follow up of those who were already planned and implemented to find out how far the objectives are fulfilled. It also helps to find out how far the instructions, suggestions and actions were followed. Appreciate if they have done well, and if not done properly, find out the cause. It gives ideas for planning for the next visit. Then the evaluation of the service. For evaluation of the service, review each family record periodically and answer the following questions. What is the immediate problem or need in this family? What is the total problem? Well, list the difficulties and hindering factors in the situation. List the helpful and supportive factors. Example, coping ability of family, availability of local resources. What has been done about the immediate problem? What plans are being made and what actions are being taken to deal with the underlying cause of the problem? How did the person respond to your visit? What changes have taken place? Have you made effective use of man, material and measures? How far the visit has been useful? What is the attitude of individual, family and community? Do you need guidance, counseling and discussion with your superior? The result of community health service is not always seen immediately. It takes time, knowledge is changed, but attitude, habit and behavior change is difficult. But once changed, it has a permanent effect. Explain the home visit back. It is also one of the essential steps of home visiting. The major objective of healthcare services is the home is to help people with their health problems and work with them towards keeping the family healthy. The purpose of the bag is to carry out necessary equipment to perform nursing care in the home. Example, performing minor dressing, conducting a delivery. It saves time and effort in the performance of nursing procedure. Frequency of the home visit. Making decision regarding the frequency of the visit is a matter of judgment. It will depend upon the extent of the health problem in the family. In no case, clinic visit by the family are substitute to family visit by the community health nurse. Family visits are basis of priorities. Available time, workload, health agencies, policies and facilities available. Priorities are established on the following guidelines. Visit in response to the need felt by the family, such as a mother in labor, acute and serious illness, etc. Visit to premature infants and infants with defects. Regular visits to postnatal mother and antenatal mother. Visit to chronically ill patients. So, supervisory visits to infants, toddler and eligible couples, collection of family information and investigation, information, education, counseling and guidance purposes. Then what is the advantage of this home visit? It helps to develop an interpersonal relationship between the family members and the nurses. A community health nurse assesses the individual family member in their own environment. It gives an opportunity to observe the background of the family members and their relationship. It helps in the basic understanding of physical and emotional needs of the individual and to guide them. It helps to gain more knowledge and become realistic in the family member, are more relaxed in their own surroundings. It also gives an opportunity to find out new health problems. Thank you, dear students. We'll follow the rest of it in the next slides.